One of the strategies that PSI has come up with in reaching out to the population with services is to set up the TUNZA Family Health Network. And this is a partnership between PSI and private health providers, out of the realization that the private sector actually provides a big portion of services in Kenya.
This network was formed in December 2008 to provide family planning services with emphasis on long-term methods of family planning.
Initially, the TUNZA social franchise was focused on family planning only, but over time we have seen the need to make sure that we are providing more holistic services. We have introduced IUDs and implants, which are long-term methods of family planning, which were long before not available in the private sector. We have integrated several services into the franchise, which cut across reproductive health, which includes cervical cancer screening. We also have integrated management of childhood illnesses, which looks at diarrhea, pneumonia, and malaria. We also have HIV counseling, testing, as well as treatment and male circumcision.
For us, it's been exciting to see our transition for the original model that we had structured TUNZA to a facility that we see will be able to take care of Sarah holistically, take care of all her different needs. And even if Sarah came up with her child, she'll be able to take care of Sarah. We'll be able to take care of Sarah, her child, and even her husband or her spouse will accompany her. There were gaps in terms of knowledge and skill sets within other health areas. And yet, when Sarah, who is our target group, walks into that facility, they don't go in for one specific health area.
Setting up a new program or a new health area in TUNZA is not an easy task. First of all, you have to really sort of identify, is this a priority for Sarah, who's our client? Then once you identify that, then you also need to see or identify the facilities that can actually implement this health area, because some of these health areas are quite specific in terms of the cadre of staff that can handle them, and also they're specific to some geographical locations. So you have to do a selection of the TUNZA facilities using a specific selecting criteria. Then after you identify them, you also need to engage them and find out if they're also willing to participate in the rollout of this new health area. Because willingness in their part is actually a very important thing for them to take up the program and implement it.
So in terms of communication, we adopt what we call 360 approach, where we do mass communication and then we cascade it to IPC, interpersonal communication. So I'm at the interpersonal communication end. So how we do it is we reach our target audiences with messages through the use of community health workers. So how they conduct it is they do small group sessions, one-on-one. The venues can be as diverse from households to chiefs barazas to marketplaces. And then after conducting the sessions, there's some women who might be in need of the services. So the community health workers do this referrals to the TUNZA clinics for the women to access, or whoever for that matter, to access the services in the TUNZA clinics.
We have to build their capacity so that we can increase their knowledge and skills in terms of giving these services. And this is normally done through a didactic and a practical form of training. Like let's say in cervical cancer, the training takes like around 5 days. 2 or 3 days where it's a classroom teaching, and 2 or 3 days practical session where they're actually involved in doing screening for the cervical cancer and they're being monitored by the trainers if they're following the correct steps in doing these procedures. Then after the training, the certification is not immediately, because we have to really follow up with them and to see if they've been able to attain the proficiency and competency in doing this skill or providing this service. And some of this actually entails them performing a minimum number of services, or I would say screenings, and doing them in the correct way for us to actually say that this provider is proficient and is competent, and that's the point now we can issue a certificate. Most of these trainings are done in collaboration with the Ministry of Health using their curriculums.
So having worked with the TUNZA franchise for the last 6 years, we realized over time that TUNZA providers are very good in the clinical aspect of the business, because naturally that is what they are trained in. But of course there was a gap, or there was sort of like a need for them to hone out their business skills, because in their own rights these are business people who are actually running a business, an operative entity which needs to make profit at the end of the day.
We've really been able to improve from our comfort zone to where we are now, what we refer to as continuous improvement. We didn't think that quality was so necessary, but we were working on the baseline KQMH safety standards or quality standards. But then from there, we really embraced self-care, and we've seen the results. There is increased customer flow, there is increased satisfaction even from the questionnaires that we have run, and the trust has really improved the business image. I can say we've really grown from seeing around 5 to 8 patients a day up to 20 to 40 per day.
Program is about quality improvement, and the quality improvement is based on a set of standards that were developed by the 3 organizations. So quality is measured against the set standards, and a solution for the gaps that are identified is offered through a quality improvement program. Once they express their interest, then we start with a quality assessment. Then the main reason for the quality assessment is to basically identify where the provider is starting from and any gaps that need to be addressed like immediately. Then from the assessment, we are able to prioritize on the things that need to be addressed through a quality improvement plan that we develop based on the assessment that we found.
It was tedious. It didn't just come one day and then things were perfect. We started by training, and then we set some goals, and we set the timeline when to accomplish the gaps that we were able to see. Some of them they did need any financial support. It is us to come and do it, with the resources that were available, like advertising to clients, talking to clients, arranging our rooms, and it has really helped us, because previously, we were giving drugs and putting the money in our pocket, and drugs we could give at anyhow. We didn't know what was remaining. We're not able to take the stock, but when we started the system, it really helped us, and we were able to see our performance. Also the record keeping of our patients. There is the privacy of the patients, because once we open the window, it is closed. We cannot be able, the records are not just lying anywhere for anybody to see.
We didn't think that quality was so necessary, but we were working on the baseline KQMH safety standards or quality standards. But then from there, we really embraced self-care, and we've seen the results. There is increased customer flow, there is increased satisfaction even from the questionnaires that we have run, and the trust has really improved the business image. I can say we've really grown from seeing around 5 to 8 patients a day up to 20 to 40 per day is good.
St. Patrick has come a long way. We started a long time ago, 2001, where we started a small unit, one bedroom house, where we were giving all the services in that one room. consultation, delivery, laboratory, you can imagine. And we were having a lot of clients, and we could be able now to see the need and the services that clients, the community really needed. And so we thought of another way we can improve those services so that we can be able to reach the demand of the clients.
So we started as an outpatient facility with one room, and then eventually we grew by 2012, 2013 to include the lab and the pharmacy.
2011, we thought of buying land, having sold so many of our items, and we started constructing the new unit. That is where we are now, and we constructed the first floor, that is the ground floor, and then we were able to establish some of the departments, like we had now the waiting room, we had the record office, we had the consultation room, we started the MCH, we started the comprehensive care for HIV, delivery, dental. I am one of the people who like embracing any new idea which is focused to the making me improve my performance and also the service provision to the community. So when I was still in the TUNZA, the safe care officers also came, introduced their program, and at the same time I was able to embrace that. So we started working together, and I've really seen a lot of changes through the program.
TUNZA nilisikia nikiwa Kitengela, nikaelezewa na mama, kanielezea kuhusu mambo ya family planning. Sasa nikapata mtoto wa pili. Time nilipata huyo mtoto wa pili, nikaenda kwa clinic, nikaelezewa mambo ya family planning. Ili nilielezewa, nikaambiwa ni ukiwa na weight ya opus 80 sifai kutumia hiyo sindano. Kanielezea mambo ya coil. Family planning hiyo niliweka mwezi wa kwanza 2015, na naona nikilinganisha na wakati ile nilitumianga mara ya kwanza, hii naona iko mzuri, sijasikia shida yoyote, na hata weight yangu injapanda. Service yao wenyewe iko mzuri nikilinganisha na kwenye nilienda wakati wa kwanza. Hii ya huku iko sawa, attendance yake iko sawa, mashini zake naona ziko sawa, hata vitu zenye anatumia unapata ni vitu ziko clean.
All right, so the cervical cancer program is funded by Bill and Melinda Gates Foundation. It's a project that's implemented in partnership with 2 other organizations. So the program is about increasing coverage of screening for cervical cancer for Kenyan women, and as well as early detection of precancerous cells so that they can be treated before they become cancerous. So ideally, it's early screening for early detection. It's a project that is implemented through the social franchise largely. So for us, that's through TUNZA.
From the baseline study, we identified that the biggest gap in these providers was the ability actually to conduct safe deliveries. So this is usually referred to as basic emergency obstetric and neonatal care. So that was the biggest gap. And so what we did then was to train these providers on BMONC with the support of the Ministry of Health. And from there on, we started better accounting for the deliveries in their facilities and giving them support supervision on the same.
fever management program is about addressing fever in children under 5. And we have a focus on the endemic areas where there's a lot of disease burden, that is Nyanza, Western and Coast. So what we do is give a solution, a holistic solution for fever, so that when a child under 5 and their caregiver go to health center, they are properly managed for that fever. So it looks at pneumonia and malaria and diarrhea, because what is common among these 3 diseases is fever. So giving antibiotics for malaria, ensuring that is there in the health facility. In malaria, we're looking at diagnostics in terms of RDTs and ECTs for treatment. And then we have ORS and zinc, the combined pack, treatment pack for treatment of diarrhea. So ensuring that when a caregiver takes her child under 5 to the health facility, they are treated properly for any of these disease areas.
Awareness levels on hypertension in the country are very low. I was just looking at statistics, and they're saying that at least 1 in every 3 people in Kenya have hypertension, yet they do not know about it. The symptoms of hypertension are not that obvious until way late into complications, where somebody gets a heart attack or gets a stroke or other complications related to hypertension. That's the only time they get to know. They're looking into 3 key pillars. One of them is ensuring there is awareness and education. Then the second one is ensuring that the healthcare providers and the community health volunteers that we are hoping to engage in the system are well trained, and we have guidelines in place to help in the treatment. The other thing they're looking into is ensuring access and affordability. And what we mean by this is once people go into the clinic, are they able to get the right kind of medication and care? So AstraZeneca is looking across these 3 pillars. And for education and awareness, what they're going to be doing is we're going to work through community health volunteers, and we're going to leverage a number of channels. One of them is household visits, whereby we visit Kioko in their homes and we engage them and talk to them about hypertension. And once they are ready and they understand about hypertension, the community health volunteer will be equipped with a BP monitor, and they are able to screen them then. Should the patient present themselves with some elevated readings, that is above the normal, which is 140/90, then they refer them to the TUNZA facilities.
TUNZA is going to transform significantly, because we look at it as definitely going just beyond the family planning or the HIV counseling testing that it had in the past, but it will be a one-stop shop where somebody would actually be able to come in with their whole family and actually be treated and actually be able to walk out with different forms of medicines that they'll get in any private sector facility. We see TUNZA moving out from being more of just a small 2-room facility to big, medium-sized facilities that are integrated within the government systems and are able to tap in also through the various county governments as additional service points that they'll have to serve Sarah going forward.
TUNZA is my mother.